All right. So for the next type of tumor markers which we'll be looking at is what is known as the tumor suppressor genes. All right. So let me just define the terminologies. If I define things here, of course, you will be able to have an idea of what the whole lecture is about. Now, first of all, you should know that tumor markers are basically things in the body that will help us to now confirm if there is a cancer. Do you understand? Then tumor suppressor genes on the other side, they are actually things in the body that will help to keep any possible tumor that should actually come up in the body down. They suppress the tumors. Do you understand? So these tumor markers can be, these tumor suppressor genes can be tumor markers. Why? Let me say a tumor suppressor gene now is supposed to be in so amount in the body. If you are assaying the body and see that it's not up to that amount, of course you know that there's what? Reduction in the level of tumor suppressor genes. You understand? So just a brief lecture, just look at the possible ones. Now just look at the individual tumor markers, all right, and any abnormality with them. We also look at the common cancers that usually come up from that. So for the tumor markers, we have the RB gene. RB gene is the retinoblastoma gene. All right. So I think, okay. So it is what hypophosphorylated form complexity with what? Transcription factors. All right. So it blocks transcription of genes in the X phase cells. All right. So there's loss of function in it. So if there's loss of function in it, it usually leads to what? Increased DNA synthesis. Your DNA, they will just be making a whole lot of DNA without any control, you know. So this leads to increased DNA synthesis and cellular proliferation. The cells are growing too much. That's what usually leads to a tumor. So screening for RB mutations determines RB susceptibility in familial form. All right, then a P53. So P53, its normal function is to arrest the cell cycle. All right, so it inhibits the G1 phase. That's via P21. All right, in response to DNA damage. That's the normal work, you know. So 80% of colon cancer patients have deletion of one gene and point mutation in the other allele. So I'm not saying only colon cancer. Alright, P53 is linked to a whole lot of cancers. Here we're just trying to give you examples. Then we have the BRCA1 and BRCA2. Of course, that one is basically problems in women. So mutations in these genes is associated with breast cancer, ovarian cancer. So BRCA1 mutation carriers have 85% risk to develop breast cancer and 45% risk to develop ovarian cancer by the age of 85. Then we have the APC. All right, APC gene is known as what? Adenomatous polyposis coli. So if there's mutation in the APC gene, usually leads to about, like, it causes colorectal cancer. So in about 70% of colorectal cancers is linked to a mutation in the APC gene. Then we have the NF1. NF1 is a neurofibromatosis 1. Alright, neurofibromine, similar to the GTPase activating protein. So if there's loss of function in the neurofibromatosis 1 gene, it leads to continuous cell activation. Like the cell activation is just going on. So it can also cause things like von Recklinghausen disease, alright, colorectal cancer, melanoma, neuroblastoma, alright. Then the Wilms tumor 1 gene, alright. Of course, if there's mutation in it, it should cause the Wilms tumor. That's also known as it is nephroblastoma, something like that. Alright, then the DCC is deleted in colorectal carcinoma. Deletion associated with advanced stage and poor prognosis in colon cancer, although better prognosis and tumor differentiation is seen in gastric cancer. All right, then we have the PTEN. If there's mutations in the PTEN, it usually causes what? Apoptosis inhibition. Like there's no programmed cell death going on, you know, so it's usually associated with advanced tumor stage and poor prognosis in breast cancer, liver cancer, cervical cancer. Right, so that was it for using tumor markers or tumor suppressor genes as tumor markers.